Good morning, everyone. Great to be here this morning, and really it's an honor to be part of this discussion. As Danielle said, I'm Judith Carta, and one of the things that she didn't mention about me is that I'm the director of the Bridging the Word Gap Research Network, which is funded by HRSA. And I'm also an early childhood person. So when we first were funded by HRSA to do work around the word gap, a focus on language, I was interested to know how it was that a federal agency that's primarily concerned with health was interested in language and the word gap. And so what I'm going to tell you about today maybe will give you a little inkling about why that's so. I think it really talks to the theme of how do we bring together health and early childhood in order to have lasting impact on children's lives. So maybe I should begin by just spending a little time talking about the word gap and explaining what we're doing in the Bridging the Word Gap Research Network. So I think you probably all know about the fact that children who are growing up in poverty, by the time that they're 3, are typically exposed to 30 million fewer words than children from upper income backgrounds. And that work comes from the Hart and Risley research that was done back in the late 1980s, early 90s. And what they found was that by 36 months, children from lower income backgrounds were considerably behind children from upper income backgrounds. And what we found when we followed up those children is that the gap that began in those very early years really kept following those children. So the disparity between lower and higher income children just grew over time as we followed them into elementary grades. Now, why is it important that that gap exists? Well, it's important because it also sets the stage for a gap in vocabulary development. So by the time children are 3 years old, higher income children have double the vocabulary of lower income children. And vocabulary, of course, sets the stage for reading development. And we know that vocabulary by age 3 is an important predictor of reading by 3rd grade. And reading in 3rd grade is a critical predictor for later life success. It's the most important predictor for high school graduation. So we know that children who can't read in 3rd grade are 4 times more likely to drop out of high school, and 6 times as likely to drop out of high school if they are also living in poverty. So these are important, really important facts, because we've known about this discrepancy between higher and lower income children in terms of their language experience for a long time. But why is it that we haven't made population level impacts on this gap? This gap, which really is not only a discrepancy in performance in language, but because it's tied to so many other life outcomes, it's also a health disparity and a life outcome disparity. So, but the good news is we know what it takes to bridge the word gap. We've had evidence-based interventions that we know can change the way caregivers provide a rich language experience to children. And what's even more important is that these are easy-to-do behaviors and interactions that adults can engage in with their children, and they can embed it in their regular routines. So we have all the ingredients for reducing the word gap, but now it's time to really start bringing together multiple sectors in order to achieve that effect. But the bad news is we haven't gotten the word out about how important it is for adults, parents, caregivers, early educators to be talking to children and providing a rich language interaction with the children that they see every day. So what will it take to move the needle on the word gap? Well, it's going to take prevention. So we need broader public awareness of the importance of talking to children. And we need a greater variety of programs to be conveying that message to parents and early educators, child care providers, everyone who typically interacts with children on a daily basis. So we need to get the message out, and we need to help adults understand what they can do to provide a richer language environment for children. So we need prevention, but we also need intervention. So as you could see from that graph that I showed you at the very beginning, we know that children start falling behind typical language development very early. So by the time children are 2, we have pretty strong predictors of who is already significantly behind in their language development. So why aren't we finding those children and providing more intense intervention around those children? So we have the evidence-based practices to provide that intervention, but we need to get those out. We need to scale those up. We need to provide the professional development to early educators and to provide the training to parents and child care providers. And so HRSA funded the Bridging the Word Gap Research Network to bring together the multiple sectors of agencies and individuals who were already doing work in this area of intervention and prevention, realizing that there was a lot of parallel activity going on across the sectors, but not enough integration of the sectors of individuals who were doing this work. And so what the Bridging the Word Gap Research Network is trying to do is reduce the vocabulary gap of children from lower income backgrounds by increasing their language learning experiences, trying to help everyone who works with children provide that language experience. So what we're doing very briefly is, as a network, we're synthesizing all of the research that's been done around prevention and intervention in this area to find out what really works, and then trying to scale it up by sharing the most effective practices with the diverse variety of stakeholders and disciplines that have an impact on children. We're also identifying the research gaps to find out what's missing in our available research and developing new studies and new innovations in order to do greater prevention and intervention. And then finally, what we're doing is growing what we're calling a practice-based research collaborative. So we've identified hotspots of innovation where researchers are working together with programs in this area of bridging the word gap and developing new prevention and interventions. So I'm going to tell you now about different examples of how multiple sectors are working together to do work in this area. And so first of all, I want to tell you about the kinds of public awareness campaigns that are going on in the community. Because if we're going to make an impact in this area, as I said before, we need to get the word out about the importance of talking more to children. So one of the big examples is Too Small to Fail, which is an initiative sponsored by the Clinton Foundation and the Opportunity Institute. And so what Too Small to Fail is doing is working with communities across the country and helping them provide public awareness and action campaigns to promote the importance of early brain development and language development. And so what they are doing when they go into a community they engage community leaders across multiple sectors. So they bring together pediatrics, housing, early education, faith-based leaders, community-based organizations. And what they do is develop public awareness campaigns, and what they're trying to do is empower parents to help them know what a critical role they play in providing good language environments for their children. And so they've engaged parents in very innovative ways by meeting parents where they live and where they spend time with children. So they have ways of prompting parents in places like laundromats, supermarkets, playgrounds, and providing ideas for parents about what they can be talking about with their children when they're in those environments. And so they've developed partnerships with like the Laundromat Association in the United States to help get the message out in the areas, in the places, in the communities where families spend their time. Another multi-sector collaboration going on right here in New York City is City's First Readers. And that is an initiative of the New York City Council. And what the City Council has done through City First Readers is bring together many of the diverse partners in the city that are doing important work in the area of promoting early literacy and language. So partners that typically wouldn't be working together, like the Brooklyn and Queens Public Libraries, Reach Out and Read, and the Video Interaction Project that's being done right here at NYU Medical Center by Alan Mendelsohn and Adriana Weisletter, right here in our audience. And then you can see the other kinds of organizations, early childhood organizations, literacy promoting organizations, home visiting organizations. So doing really a full court press around the importance of early literacy and making sure that prevention and intervention goes on in a broad-based way throughout the city. So bringing together multiple agencies and multiple sectors in a community is one way of getting the word out. Another is reaching parents through population-based interventions in situations where we can reach many parents. And the pediatric public health sector is one way that many parents get engaged. Most parents bring their children in for pediatric primary care. And so these two interventions are ways in which people have used that pediatric primary prevention to get the message out and get training out to parents about how important it is to be talking to children. So Talk With Me Baby is Georgia's public health sector intervention in which they're using the message that parents are providing language nutrition for their children when they interact and talk with their children. And so what they do is use pediatric primary health and pediatric nurses when parents come in for their well child visits. They engage parents and give them training about things that they can do at each of the different milestones of development in order to promote children's language. So little brains need lots of words to grow and thrive, and just like a child needs an adequate amount of food to grow and thrive, so they also need language. And so this is the kind of message that transpires in the Georgia Public Health Initiative. And that goes on throughout the state of Georgia, and it's reaching almost all lower income children within the state of Georgia. And an important point to bring out here is all of these agencies that came together to make this initiative happen. Another example of an initiative that has been around for a long time that is employed through pediatric prevention is Reach Out and Read. It's a national program that makes literacy a standard part of pediatric primary care. And what's important is the reach that it's had and the evidence base that shows that it's effective. Right now, it's reaching 25% of all low-income children. So when we talk about scaling up, here's a successful example of scaling up an important initiative that makes a difference in terms of promoting early literacy and language. And it's also low cost. So one final area of intervention are those interventions that work more intensively with parents and gives them specific training about the kinds of strategies that they can use to promote children's early language and literacy. And three examples that I have here are the Video Interaction Project, which is also being implemented and evaluated by Alan Mendelson and his team here at NYU. 30 Million Words, which is an initiative that Dana Susskind has at the University of Chicago that recruits parents right after they've given birth in a hospital and then engages parents in about a 6-month intervention of home visiting, giving them skills to talk and interact with their children. And then Talk, which is a professional development program for early childhood educators that gives them the same kind of strategies that we know can make a difference in children's outcomes. So I'm just going to go right over that. Just to summarize some take-home points. We know that in this area of the word gap, that multi-sector collaboration is taking place. So you've seen me talk about sectors that are working together around public awareness campaigns in communities, agencies that are working together toward common goals like City First Readers. But I think an important point here is that we really haven't gone far enough in this multi-sector work in this space, because what's happening is agencies are working side by side on similar goals, but there's still, I think, room to grow in terms of the intersection between the sectors, so that it would be great to see more integration of the work being done here. So sharing of data across sectors on children as they're, sharing of data between the pediatric setting in terms of early screening, and then other settings where the children may be receiving intervention, like early childhood education centers or home visiting programs. And so I guess the bottom line is when we work together, we can develop word gap interventions that can strengthen parental bonds, that can promote resilience, give children a better language background, that will influence multiple outcomes in their lives. And so basically, this is an area where children's not only their academic achievement, their school performance, but also their social emotional development and life outcomes and health outcomes will be impacted. And so, you know, what we're talking about here through work in prevention and intervention is protecting children against health conditions and diseases. So, you know, this is a way of making sure that children enter adulthood being prepared for whatever life throws at them. So, thanks very much.